So Sally, we're about to see Taylor. What do you know about her?
So I know Taylor's a 6-month-old baby girl born via vaginal delivery at term after an uneventful pregnancy. Her APGAR score indicates that she had no issues at birth and her healthy hearing screen was normal. She's the first baby for parents Cassie and Jack. Dad works full-time and Mum stays home with Taylor. She's been referred to physiotherapy today from the Paediatric Registrar for assessment of developmental delay. So it says Taylor was admitted from hospital from ED 4 days ago for investigation of failure to thrive. She has a history of poor feeding, weight loss, dehydration and general irritability with recent coffee ground vomiting. I also saw in the note she's booked for an endoscopy tomorrow for confirmation of suspected cow's milk protein allergy and related eosinophilic esophagitis.
It's a tricky word, isn't it?
Yeah.
Do you know what eosinophilic esophagitis is?
I looked it up last night. It's an inflammatory condition of the stomach and the esophagus, which could be related to food allergy.
That's great. Have you found any other relevant information?
She's on a drug called ranitidine to help with her tummy problems. And I have noted that she has a history of some diarrhea, coughs and runny nose, but all tests have come back to show she's not infectious. She's been seen by gastroenterology and the dietitian today and commenced on a new formula called Neocate. She has bottles during the day and continuous overnight NG tube feeds to improve her weight gain because she's below the 3rd centile for her age and weight. The social worker's visited and she reports in her notes that Mum Cassie is extremely tired, anxious, and she's also a little bit concerned and not coping well with the hospital admission.
That was a very comprehensive history. When do you think would be a good time to see Taylor today?
Well, the nurse looking after her said that she had a feed an hour ago, but that she pulled her NG tube out. So they're not going to re-site it until later tonight. I think she's been a bit irritable this morning, but her obs are stable and she hasn't had any vomits. So she's awake now, so I think now would be a good time to see her, if Mum's agreeable.
That sounds very sensible. So Taylor's been referred to physio for developmental delay. What questions would you like to ask?
I have most of the information I need from the chart, and I don't want to stress Mum out by asking her more questions that she's already been asked. In my subjective examination, I'd like to confirm some of these details and answer any questions and concerns that Mum has.
Now, thinking of your objective examination, what would you expect to see in a typically developing 6-month-old baby?
Well, I'd expect her to be able to play on her hands in prone and maybe pivot on her stomach. She should also be able to roll both ways and maybe try sitting on her own. She should be able to play with both hands as well as doing a lot of reciprocal kicking. I think she should also be able to take weight well on her feet and have good head control and pull to sit. I've also read something about infant pattern movements being integrated by this stage.
Okay, that all sounds good. How would you like to structure assessment with the Taylor today?
Because she's still irritable and both her and Mum haven't had a lot of sleep, they both might be quite tired and not able to manage a large or time-consuming assessment. So my priorities would be a brief neurological exam, maybe tone and clonus, because I've read in the chart the doctors felt that she's had a little bit of increased lower limb tone and she was arching her back a lot. I would also have a look at her gross motor skills in some different positions and maybe some of her visual play skills. There's also some things I know I should assess, but I might not get time to do those, such as her sensory system, infant patterns in movement, and early postural control.
Okay, that sounds good. Let's go and see Cassie and Taylor. I've already popped in and spoken to Mum, and she's happy for you to do a student assessment today.
Okay. Hi, Cassie.
Hi.
Taylor.
Yeah.
She's a cutie, isn't she?
I think so.
So, I'm Sally, the final year physiotherapy student, and this is my educator, Jenny.
Hi, Cassie.
So we've been asked to come and see you today because Taylor's been having a little bit of problems with her belly, according to the paediatrician.
Yeah, she has. She's had some tummy pains, and that's why we're here.
Okay. And she's also having a little bit of developmental delays.
Yeah, the doctor mentioned that the other day. I didn't even realise there was anything wrong with her apart from the sleeping and the feeding.
Well, that's okay. We can have a look at that today. Now, our assessment shouldn't take more than 30 minutes, but if Taylor's had enough, then we can stop. Is that okay with you?
Yeah, sure. She's pretty tired and she's been a bit cranky, but she's doing better today.
Alright, great.
Yeah.
So I can see from the notes that the doctor might have an answer to why Taylor's been having such difficulties with feeding, putting on weight, and why she's had a bit of tummy discomfort.
Yeah, they've told me they think she's got a cow's milk protein allergy, but they're doing one more test tomorrow and then they'll know for sure.
Well, that must be a relief for you to know that she'll be feeling a bit better soon.
Yeah, I hope so. I hope we can get some answers. I just don't know what that means for me though, what I can do to help her.
Well, I'm sure that when Taylor's feeling a little bit better and you're ready to go home, and you've got a little bit more information, then you'll be more confident in how to help her.
Yeah, I hope so.
So for now, let's just focus on how she's doing and developing and how she's playing. Do you have any concerns or thoughts about that?
Well, like I said, I didn't realise she wasn't doing what she was supposed to. She really doesn't like being on her tummy. I've tried her on my chest as well and she just doesn't like it. She's not rolling, but I thought that was normal for her age. She really likes sitting. That's the only position she's really comfortable in.
Yeah. Well, that must be exhausting for you at home.
Yeah, it can
So
be.
with her tummy, have you tried different ways of doing that besides the chest and...
No, that's all I thought of.
Okay. And how long would she manage before she starts crying?
Oh, probably not more than a minute, really.
Okay. So often babies who have tummy discomfort don't like playing on their tummy, even though you've tried with Taylor.
Yeah.
It also might be because she's got no energy, and that could make it a little bit harder for her because she might be quite weak.
Okay.
So we'll have a look at that today and see if we can find a more appropriate way and a more comfortable way for Taylor to play on her tummy.
Yeah, sure.
Oh, she's really cute, isn't she?
Yeah, she's pretty tired, so
Yeah.
we'll see how we go.
Hi. Okay, Cassie, if you wouldn't mind putting Taylor in the cot and we can do our assessment, and I'll just go and clean my hands.
Okay, no worries. No, I'm hoping she doesn't spew. She's pretty cranky and a bit upset today. And you're okay if her outfit stays on because she's got eczema and she's been
Yeah,
scratching it.
that's totally okay. And we've got some extra towels and stuff just in case she does want it.
Okay, great.
Hello. Alright, so would you just mind coming and standing while I go and grab some toys?
Sure.
And Cassie, if you want to come around the other side, that way you can watch and see what we're doing.
Okay, sure.
So I'll just start to see her landscape. Here we go. And up and down. Oh. She really is good at following things with her eyes, isn't she?
Yeah, she looks for me all the time at home. She looks for her dad, Jack, too, when he walks in the door from work.
I'm just going to test her muscles. And I'll do the arms. 2 and 3 and 4 and 5 and 1, 2 and 3, 4. Okay. And now we're just going to practice her sitting. So do you want to grab the rattle, then she can have a play out when we've got her up. Okay, ready? Ready? Up. Oh. Let me try again. Ready? Ready? Up. Oh. Okay. I'm going to try again. Oh, look at that. Okay. We'll just have a look at her sitting for a minute. Do you want to play with her with the rattle?
Yeah, sure.
Hey, Taylor. Look, it's Mama. Say hi, Mama. She really does like sitting, doesn't she?
She does. It's her favourite position at home.
Alright. I'm just going to put her back down and we'll help her roll onto her tummy. Okay, are you ready? We'll just make sure her arms a bit out of the way. There we go. Look at that. Hey Taylor. Hey darling.
Oh, it's a bit tricky, isn't it?
She doesn't like being on her belly, does she?
Not so much.
Alright, so I just roll it back onto her back. Yeah, she's having a little bit of tummy discomfort from what I can see, which, you know, because she might be in a little bit of pain, and with the food allergy that's quite normal.
Okay.
From what I can see though, she's still doing some really beautiful things with her development. They're actually really nice. And yeah, hopefully once the food allergy, if it's identified and the pain goes away, she might have a little bit more enjoyment from being on her belly, and those skills might start to progress a little bit more.
Okay, that's good to know.
Oh, it's so good. Alright, well if you just want to give her a little bit of a cuddle, I think she might want to go back to mum for a little bit.
Sure.
Well, it looks like Taylor's a little bit more settled now. So if you want, we can try some positions in prone with the therapy ball.
Okay,
Yeah.
we can give that
So
a
if
go.
you just want to come and sit down on the seat over this side. Would you be able to help me hold the ball?
Sure.
Okay. Alright. So if you just want to pass it to me. Alright. So I'll start her off in sitting. That way she can just get a bit used to the ball.
Okay. Hey, darling.
There we go.
Oh, look, who's that?
Oh, bounce. Bounce. She seems to be enjoying sitting on the ball, so I might just move her onto her tummy now and see how she handles that. So I'll just move her arms in front. Look at you! Dad, you're crawling. Look at that. Alright.
Hey, darling.
Do you just want to grab her toy for me?
Sure.
It's just down there.
I'll grab another one.
Ooh. Do you want to hold on to that?
Yeah, how about that?
What's that?
Okay. She's doing really well. I haven't had a ball at home.
Do you want to sit back up? That's alright. You can use a pillow, like a really soft pillow, to do the same exercise. Or maybe if Jack's free one day after work, you can stop and pick one up from a department store. They're really cheap.
Okay, sure.
But yeah, a pillow's a really good alternative.
Okay.
While we're here, do you want to have a go, Cassie, at having a go at this activity?
Okay, yeah.
So if you want to hold her, and we'll hold the ball for you. And if you want to put her back onto her belly,
On the tummy, yeah.
so we'll just make sure that our arms are forward. So just bring our
Just
arms
like that?
forward. Yep,
Yeah.
just like that, that's right, yep. Whoa. Yeah, she seems to be doing really well.
Oh, great.
So
So do we need to come back here for more physio, or do we need to see you again?
well, what I'll do is, if you wouldn't mind, we'll come back just before you go home to check on how Taylor's progressing
Okay.
and just make some arrangements for physio. I know you live about 45 minutes away on the chart, so what I can do is we can contact some physiotherapy services closer to where you are.
Yeah.
That way you're not having to come back here every other day, you know, it's a little bit easier. And I can also bring past a little brochure and a pamphlet with some pictures and explanation of the activities we've done today for you. If that's all right.
That'd be great. My memory is shocking at the moment.
Not a problem. Do you have any other questions or concerns for us today?
No, I think you've explained everything well, and I feel reassured that she's going to get better.
Okay. All right. Well, thank you for letting us play with Taylor today.
Thanks
She's
for
really
coming.
cute.
Thank you.
Okay, Sally, did the session go as you expected?
Yes, I think so. I think we covered all that Cassie could take today, and we were able to work on the most important aspects of Taylor's development, which was getting Taylor comfortable in the prone position. I have a handout to drop to Taylor and Cassie a little bit later when we're finished.
That's great. And what were the main findings from your assessment?
Taylor had some mild increased tone in her lower limbs, but there was no clonus. I'm not sure if the increased tone is of significance though.
That's okay. It's likely it's not neurological in nature, given it was not a velocity-dependent resistance to stretch. Taylor's done a lot of back arching, and this is reinforcing strong extensor movement patterns in her legs. This will settle as she feels more comfortable in her tummy. What else did you find?
Well, her rolling, playing in prone and reaching for toys are definitely delayed. I've had a go at scoring her gross motor skills on an AIMS assessment, and she was less than the 5th centile for her age, but I'd like you to check that for me.
Okay, we can have a look at that shortly. Is there anything else we need to do before Taylor's discharged?
I'd like to complete an assessment concentrating more on her sensory system and postural control. I'd also like to see if we can facilitate her to start playing with her feet and improve her rolling abilities.
Okay, that sounds like a good plan. Is there anything else we need to discuss?
Well, I've put a note in her chart about our findings and our follow-up plans for the doctors to have a look at. Would you be able to check and co-sign that for me?
Yes, that's fine.
I also want to refer Taylor to a local physiotherapist that's more easily accessible for the family. Could you please assist with that?
That's not a problem. We have a list of local physio services back in the office. I'll show you them in a second.
Okay, thanks.